Welcome to the Autism Outreach Podcast. I'm your host, Rose Griffin. I had an amazing conversation today with Eleyonzettah Bonilla. She is a fellow speech therapist and recently also a board-certified behavior analyst. She is multilingual. She is an amazing and compassionate clinician. I got to know her because I was actually her supervisor as she was taking her coursework and studying to becoming a BCBA. I have another company called Supervision Academy, and I specialize in providing remote supervision to people who are becoming BCBAs. And so over the course of a year, I really got to know her. She is an amazing clinician. And so today we talk about a bit of a hot topic. We talk all about SLP and BCBA collaboration. Sometimes it can be really, really hard to work together with people who come from a different field with a different level of expertise. And so we talk today through some of these different points. And we talk about how do we translate some of the research into our everyday dealings so that our main priority is really helping the child and really helping the learner so that they become an independent and effective communicator. It's such a great episode. I'm very excited for you to listen to it. And if you haven't already, check out our new free webinar all about my 5 top tips and strategies to help your autistic students engage and communicate. That is available now at abaspeech.org. Let's dive into this episode.
You're listening to Autism Outreach Podcast, a podcast full of ready-to-use strategies to help those with autism strengthen their communication skills. Here's your host, Rose Griffin of ABAI Speech, a speech therapist and board-certified behavior analyst who shares tips you can use in your next therapy session.
All right, thanks for joining us on episode 34 of the Autism Outreach Podcast. My name is Rose Griffin, and I'm here to help you learn strategies you can use in your therapy sessions tomorrow to help your students. Today, we have with us a special guest. We have Eleyonzettah Bonilla. Thanks so much for joining us. It's so nice to have you on.
Thanks for having me, Rose.
And I met Eleyonzettah probably maybe 2 years ago now. I have a company called Supervision Academy, which I own with a business partner, and we specialize in providing remote supervision for people who are seeking their BCBA certification. And I was your supervisor. So you went through the program. Yes. And it was, you really get to know somebody. I remember you did the maximum amount of hours. So that was 6.5 hours a month. So we really kind of bonded, right? And got to know each other.
Most definitely.
Yes. And I remember one of our sessions, we were supposed to be meeting. I was kind of helping you prep for the test. And you texted me and said, I'm not going to be able to meet this week. And I said, okay, do you want to reschedule? And you said, no, that's okay. And I was like, that's not like you. And then I was like, oh my gosh, did she pass her test? And you texted me and you did. You passed your test the first time.
Yes, I did.
Bravo to you, because that test is very, very difficult. So it's hard. So kudos to you. But now you are a fellow SLP-BCBA. Some of us, we call each other unicorns. I'm not sure why. I think because there's less than 450 people worldwide that are both speech therapists. And
wow.
Yeah.
Wow.
So and very small group. And with you being bilingual or trilingual, I would imagine that makes you even more of a unicorn. You know what I mean?
Yeah, definitely being multilingual puts you, in a different category of professionalism. So it's difficult to find other people who are bilingual or multilingual. So.
That's awesome. So I know a little bit about you and your journey, but tell us a little bit about you, your journey, how you became a speech therapist, and, why did you want to become a BCBA as well? And some of those things.
Yeah. So as you mentioned, I was a speech therapist for about 12 years and had my own practice, seeing adults and children. And I said to myself, but the behavior is not changing, and sometimes the behavior was impeding with the progress of the child or the adult during therapy. And I came and learned about what this world of behavior analysis, applied behavior analysis. And I was like, I need to learn more about this. And the more I learned, the more I loved. And I fell so much in love with it that I became a BCBA. So now here in my private practice, we have both professions. I see, my patients for speech therapy and my patients for that fall under the ABA practice. And I'm just passionate about working with, neurodiverse adults and children. And, our company, Harlingen Innovative Rehab, the behavior side, Bonilla Institute of Behavioral Health. We're just passionate about helping people and changing lives. So it's been beautiful. It's a wonderful experience.
That's awesome. Yeah, that's right. So you have a new portion of your practice, right? Where you're utilizing ABA and helping. Harlingen is so interesting. It's when I lived in Austin, Texas, my husband would travel 3 nights a week. I was very didn't know anybody down there. I don't know what got me through American Idol and a lot of work. I was doing a lot of work.
Yes.
Well, he actually used to travel to Harlingen. So he was there and he would fly because it's you're far from Austin, right? You're really down there.
4 hours. 4 hours. So
okay.
Maybe 5.
Yeah. Oh my gosh. Very cool. Well, I love that you're able to impact lives in that way. And now being a speech therapist and a BCBA, it's really nice to have that very specialized way to look at language. And I mean, really for me, it's just the way that I kind of approach my whole entire life. Like if you did a day in the life with Rose, you would see that ABA kind of is all throughout my day, from my parenting style to the way that I set up systems in my business. And it really has helped me just be organized, to be systematic, and to really, really help my students. So I think it's really great that you're able to help your clients like that too. And I know tonight we're going to talk about speech therapists and BCBAs working together. And more specifically, this article that was written by 4 fellow BCBAs from the ABAI. They came out with this article called Interprofessional Collaborative Practice Between Behavior Analysts and Speech-Language Pathologists. And actually, I was looking at the authors, I wrote them down: Trina Spencer, Lena Slim, Teresa Carden, and Lindy Morgan. 2 of those people are also SLP-BCBAs. And what's interesting enough is I actually presented at ASHA. Oh my gosh, it was probably the last time it was in person. Boo-hoo. I miss in-person conferences. Kind of. I mean, I do. I like all them talking with people, and it's kind of exhausting, but I do enjoy that. And we actually did a presentation with another SLP-BCBA, Nakia Dower, and we did a hands-on lab is what they called it. And it was all about speech therapists, BCBAs. It was about assessment. And I remember I emailed Dr. Sundberg, who created the VB map. Said, hey, I'm doing this presentation. Can you, I think I didn't even ask for VB maps. I just said, hey, I'm doing this presentation. I'm really excited about it. It's a hands-on lab. And he sent me a bunch of the VB map guidebooks. And so cool. Yeah. So speech therapists could come in and we each had different stations. Mine was the VB map protocol books. And so people came in and they could look at the VB map. If you're not aware of the VB map, it's a really nice assessment. Definitely BCBAs mostly feel comfortable with it, but a lot of speech therapists do too. And what I tell speech therapists is that if you're not going to give the VB map, I completely understand that because there's definitely a learning curve there. But being able to take the report and use it to plan your intervention, it's
priceless.
Great information, right?
Definitely gives you a guide as to, where to go next with this patient, what goals should be addressed. And it's beautiful. It really is.
Yeah, I think so too. I remember when I learned more about verbal behaviors when I was in Austin, Texas. Actually, my BCBA supervisor owns Central Texas Autism Center, Kelly Woodrich, and her supervisor was Dr. Carbone, who's really big in verbal behavior world, ABAI. And I remember learning about verbal behavior. I read Dr. Mary Barbera's book, The Verbal Behavior Approach, and it just made so much sense. And ever since I've kind of just been honing, how I work on language and bring the two fields together, because there really is definitely some overlap, between.
Most definitely.
Yeah. So what do you think about embracing the overlap? I know that's something that we're going to talk about. Any strategies for that?
Yeah. So it can be very difficult, especially, especially when you see someone doing what you're trained to do. And especially talking about speech therapists and BCBAs, it can be difficult. You're like, wait a minute. That person's not supposed to be doing that. Or wait a minute, she's trying to do my job. So they can definitely you can definitely feel like you're being encroached upon. But what I liked about this article is it addressed the tension that could possibly arise between BCBAs and speech-language pathologists. So, and what I liked about the article is that they stressed the importance of working together. And how do you work with someone who is able to do some of the same things that you're able to do, that their scope of practice kind of overlaps within your scope of practice. But one thing that has to be recognized is that a lot of this is occurring because of who is governing our professions. Speech-language pathologists, we have we have ASHA, the American Speech Language and Hearing Association. But BCBAs, they have the board, the behavior analysis, certification board. Mm-hmm. And they also have other boards, such as psychology. So it's important to be transparent, first of all, to your colleague about what scope of practice, regulates your work, your what you're doing. So, even when, we're careful to provide services, to our respective practice bubble and our scope of practices, there can be some confusion and defensiveness when you see an SLP or BCBA practicing, as I mentioned, in that same area. So,
yeah. And I think it's definitely something that by region, people are more comfortable with. I think that collaboration can be hard for anybody. Like I have this story that I had a student who uses an AAC device and yes. I had worked with the student for a long time and the student was actually doing great, very independent communicator with their AAC device. And I had been on this case for a couple years. And then there was a new BCBA that was an outside provider and they were working in the home environment and they wanted me to take all these buttons off the student's AAC device. And that wasn't brought up in a meeting. It was an email. Yeah. And so I sent a couple venting text messages to my fellow SLPs/BCBAs who I vent to about these things. And then, I wrote a professional email and we had a discussion and we worked through some of the questions that this person had. But I think for anybody, for me being an SLP BCBA, and I've been a speech therapist for 20 years and duly certified for 10, wow. And I deal with this. You know what I mean?
Yeah, so definitely.
Yeah. And what I liked about that article is that it said there are times that there could be encroachment issues. It even says that, but there's a lot of ways that we can facilitate collaboration. And so that really depends on the speech therapist being professional, the BCBA being professional. And we know, like I've met speech therapists that I probably don't really care for, and I've met BCBAs that I don't really care for. And so I think what happens is a speech therapist meets a BCBA or vice versa. They don't care for that particular person or it's not a positive relationship. Mm-hmm. And then they just think every single encounter is going to be like that.
Exactly. And when the focus is the patient, Rose, as you know, when you keep that as your focus, just kind of the example that you gave. I mean, obviously you were able to put aside any feelings or any vibes you were getting from the other speech therapist, from the other BCBA. So really make sure that this patient was getting the best quality care. I mean, no one ever said, oh, there's too many professionals helping this child or helping this client. I mean, no one has ever said that. But the main point that the article made when discussing the overlap was, regardless of our scopes of practice, we should be willing and prepared, just as you did, to collaborate and consult with each other as often as needed. So, one of the things that they mentioned is one thing that you can focus on is a strength. Okay, as SLPs, we can diagnose, we're very knowledgeable about spoken and written language, listening, processing, reading, pragmatics. As you mentioned, an AAC device, if a person is nonverbal and the only thing they can move are their eyes, okay, what kind of AAC device is out there for that type of person? An SLP would be knowledgeable about that information. And just in terms of cognition and feeding, these are things where an SLP is very strong in these areas. Now, when it comes to a BCBA, data collection, discussing behavior interventions to treat things like elopement, functional behavior assessments to find the function of challenging behavior. Also identifying through observation, what's reinforcing and motivating for the individual. And just if you're into research, single case design, BCBAs, we can talk all day about data and graphs and, methodologies for teaching effectively. So these are the things that we should be looking to each other to collaborate to provide the best quality, effective care for these patients, for our clients.
Absolutely. And I think the one thing that happens, and I see often, is that there will be a student who maybe engages in problem behavior, and maybe they're younger, and, maybe that problem behavior is, not so much a barrier to their learning. And then as the student gets older and, maybe they start having some unsafe problem behavior, and then the student's not making progress, maybe the student's not communicating, maybe the student's having trouble doing activities of daily living. And then an outside consultant comes in, and then they do all the things you're saying, right? They're observing, they're evaluating, but it makes the school team, because I am a school therapist 3 days a week, it can make that school team feel very defensive, because what oftentimes happens is the school team is maybe not antecedently. Now, I work in an amazing district, so we have BCBAs with us all the time, but, maybe they're not really getting the support that they need before it becomes such a barrier to that student's learning and functioning. So the school team, I think, feels very defensive. And here comes this outside consultant who does have this specialized skill set. And I really love it when somebody from the outside, like if my students get an IEE, like an individual evaluation, I'm like, oh, great. Look at this, 12-page report that I can paraphrase and utilize, right? Because as a school therapist, you would never have the time that those IEEs take. It's just very time consuming, those reports. So I think that sometimes BCBAs come in and the situation is already not a good vibe, like we've been saying, and then it really kind of, erodes the professional relationship. Sometimes when a BCBA might be questioning people like, well, why did you do this? Or where's your data for that? Is that evidence-based practice? And these are the things that, like, in reality, this is really what happens. And then you feel kind of defensive. I mean, I think anybody would in that situation. So sometimes it's hard when it's already a negative situation to make sure you have that professional rapport. I mean, we've all been in these situations, right? Where we're working with a specialist, or maybe you are the specialist and then you're feeling like, I want to give this feedback, right? And it all goes back to, I care about this child. I want this learner to succeed. Yeah. So I think that idea of like keeping it focused on the child, like I've definitely had some very contentious meetings more from when I was an administrator down in Texas. And what really kept it kind of neutral was just remaining calm and neutral, right? Even though everybody gets really upset about stuff. And then just bringing it back to the child and data, like let's analyze the data. Let's see where we're at with that. So I think you bring up a lot of good points there.
Yeah. And just, and the article kind of talked about that, and their solution that they mentioned was interpersonal collaboration competencies. They're saying that and recommending that practitioners and organizations train their employees, their professionals to adopt, I think they called it the World Health Organization framework for action on interpersonal practice. So what they call IPP. So this interprofessional practice, what it does is just encourages this multi-group of health professionals and an array of professional backgrounds to collaborate on patient care, families, caregivers, communities, in order to administer this superior quality of care. And I liked that they actually laid out these 4 competencies. For example, one of the first competencies was values and ethics. And the aim of this competency is working together for mutual respect and shared values, kind of what you were mentioning, Rose. I mean, when you're going into these environments where you may be feeling a little defensive, I mean, that is definitely important to make sure you're focusing on your shared values. Another competency that they mentioned was acknowledging roles and responsibilities. It's okay to talk about our relative scopes of practices, both SLPs and BCBAs. They have to be modest and they have to be candid about their professional limitations and their competencies, but also, take a step back. Let me learn and understand about the role of this other professional. So understanding of our colleagues' scope of practice and competence and all of these, but most importantly, avoiding making assumptions about roles and responsibilities. That's where the defensiveness comes from.
Yeah. And I love that because I've actually done a couple presentations where I use those 4 exact things you're talking about. And the one thing that I always loved from that framework is this idea of role release and role extension, because I know when I am providing speech therapy and I'm doing it collaboratively, that I am probably operating in a little bit of a different way when I'm on a team for students with complex needs. And so, that might mean that, one of the things I've done a training on before is a COIC training or verbal imitation. And so I have students who are in, ABA type programs, or they're in public school and they're getting that programming. And so I, as the speech therapist, would do a sound inventory and I would, pick out all the functional targets. We would work on them together. And then once the student has met criterion with those, then I would train the paraprofessionals or the RBTs to then provide practice on those throughout the week in a form of maintenance. And so that's this idea of, I don't own articulation. Now, I'm not going to ask a paraprofessional to, provide instruction on speech sounds that a student can't say. But once the student has met that criterion, I feel very comfortable training staff and saying, this has been done already. I just want to give the student more opportunities to practice. And so I feel like those are some of those areas where I've had practice with, that role extension, role release, and things like that.
Yeah. And I love that. I love what, you just said. I don't own. We don't own verbal behavior. We don't own articulation. So that is definitely beautiful. Definitely a beautiful takeaway from the application of these competencies. I know also too, they had a third competency, which is communicating in a manner that supports the team. Leave all the condescending, demeaning, sarcastic, read between the lines sort of communication, because it does nothing for the patient. Really, it doesn't. So keep the focus on the patient, remain positive, proactive, and listen with empathy to our, professionals, our collaborators, our colleagues. Definitely. And I know one of the last and final competencies that they mentioned was also focus on being a team. Team building values and principles. SLPs and BCBAs, we share a common framework. Ethically, integrating the best available evidence with clinical professional proficiencies while keeping the client values, as we mentioned once again, in mind. And they really emphasize that both professionals need to contribute to the improvement of the team process and overall performance. So when you're going into these meetings and you're discussing a child, it's not about you, it's about the child and your team. So I really love that. And ethically, we as BCBAs, we know that part of our ethical duty is to carry out that treatment plan, whether it goes along with, it aligns with our values or not. So you really want to make sure that we're ethically working together. So really enjoyed this article.
Yeah, it's a great article. And I think a lot of people are, taking note of it. And I think that it's good to talk about how we can apply these things to our everyday lives, because I know that a lot of speech therapists and BCBAs are working together collaboratively, and maybe they are really struggling with that kind of collaborative piece. I know that it seems to be a little bit easier when you're working in a clinic and all the professionals are there. As a school-based therapist, what I try to do, we do have, even though I'm a BCBA, I'm employed as a speech therapist. So we do have an outside BCBA that we work with. And so I try to make sure that if I'm at the meetings that I can be there. And if not, I make sure that I touch base with them if there's any changes, like you said, maybe about a behavior plan or about something that they're helping us kind of navigate. And it's just good to make sure that you have that ongoing communication with all members of the team. Really, that's kind of one of the perks of advantages of collaborative practice, really just helping our clients, who have complex communication disorders.
Definitely supporting them, the best way that we can. So I know this article did a very good job of bringing to light this secretive, what are they doing? No, what are they doing situation? And it just brought it out to the open. And I think really focused on it more. There's been articles about how we can collaborate with BCBAs or SLPs, but just the way that this was presented was in a way that just really kind of really brings to light the importance of working together and setting aside differences. And so,
yeah, and we definitely will link up the article too. It's just, it's an open access article. So it's right on the ABAI website, but we'll make sure that we have a link for that in the show notes. And really great information. So, I always ask everybody the same kind of ending question. It's a little food for thought. So what is the most important piece of advice that you would want to pass along to parents or professionals about communication?
The most important advice, of course, is definitely whether you're a child or whether you're working with an older adult or an older child, it's very, very important to recognize when a child needs help or needs services. I have parents, for example, who come to see me when a child is 8 years old, but they've been telling the doctor ever since the child was 2 that something's not right. That is one of the biggest concerns that I've had as a speech-language pathologist. And it's very important to demand that you get the services for your child. And even if you're made to feel like you are a parent who is overprotective or, have too much anxiety about your child's progress, you have to go with your gut feeling as a parent. If you feel that something is not right, even if it's an older adult, even if it's an adult, a young adult or an older adult, you have to get these services because disorders and impairments don't wait. They progress. And if nothing is ever done, your child or your loved one continues to fall behind. And of course, help is out there, but the sooner, the better. So communication is important. It's how we live. It's how we interact with one another. And that is a quality of life issue when your loved one can't communicate. So
yeah, I think that's a good point. I've been working with a lot more younger students with autism, again, in my private practice. And I know one of the families I'm working with just feels like, oh my gosh, I wish we would have known sooner. My son was saying a lot of things, but wasn't interacting socially. And so, I think too, and it might just by culture depend on the family structure, but do you think sometimes too that some moms or dads might be voicing some concerns to other family members, and family members may say like, oh, he or she is fine. And so-and-so didn't talk till they were 6. And I mean, I've definitely heard some of that. So
or your dad was your husband was like that when he was little. Right. Or your wife did the same thing that's explaining why, dad is probably having problems at work, why he can't learn certain things, why certain aspects of communication are difficult for him. Your dad was shy also. He didn't like to talk to me, but he'll be fine. There's no such thing as he'll grow out of it. When it's a speech and
I think now with COVID too, so many people were not getting the evaluations or they were put on a wait list. And that was actually why ABA Speech, we've started doing teletherapy in 12 states and abroad, just because I was getting so many different inquiries from people that would see me on Instagram or see me on a podcast and say like, hey, can you do a consult or can you see my child for therapy? And I was like, oh my gosh, I'm only licensed here in Ohio and actually Washington State now, which is kind of new. But I really wanted to be able to say yes to so many more people because people might be on a wait list. They might be just curious, like, am I getting the right services? Because there are a lot of different ABA providers and every speech therapist has a different way of doing things, And so people just want to use somebody as a sounding board too. So awesome. Well, now where can people find out more about you and your work?
Well, I'm on Instagram at multilingual SLP-BCBA, so they can definitely join me there. So definitely, I love connecting with future SLPs, future BCBAs, and SLPs that are already in the field. So it's just really great for us to collaborate and have a platform to do so.
Absolutely. I hope I'm following you. You have to follow me. Am I following you? I don't know.
Yes,
okay.
Okay.
Good. I love Instagram, all about social media. Well, it was so nice to see you. Make sure everybody to check the show notes. We'll link up that particular article that we talked about and any other resources we discussed. Here at ABA Speech, we have a new free on-demand webinar all about getting started with students, how to help them engage and communicate. So make sure to check that out. I hope that you enjoyed the show. And if you haven't done so already, make sure to hit subscribe and write a review. Remember to keep things fun and functional. And I'll see you next time. Bye.
Bye.
Thanks for listening to Autism Outreach. If you enjoyed the show today, make sure to subscribe so you don't miss an episode full of actionable strategies you can use in your therapy room. Write a review too. That would mean so much to me. I always love hearing from you. Have a specific topic that you want included on a future show? Reach out over on Instagram, ABA Speech by Rose, or visit me at www.abaspeech.org.